My name is Eddie Chaloner. I'm a consultant vascular surgeon and my main interest is the minimally invasive treatment of varicose veins. Varicose veins happen when the blood flows the wrong way in the veins of the leg. Patients notice them as big blue bulgy veins, usually appearing on the calf, and they can be unsightly as well as uncomfortable. Essentially what happens is that the valves in the veins, which are supposed to make the blood flow up the leg, fail, and the blood then flows down the leg, making the veins distend, bulge out and become visible. Varicose veins are extremely common. About a third of us will get varicose veins at some time of our lives, and they can affect everyone from the age of 19 to 90. However, the commonest sort of person that suffers from varicose veins is usually a middle-aged person, more frequently female than male, usually in around about the fourth or fifth decade of life that most people notice varicosities on the lower parts of the leg, although younger people do get them too. Varicose veins cause quite a number of symptoms. The most obvious thing is the cosmetic dissatisfaction, but aside from that, they do cause medical problems as well. The most common symptoms that people get are aching, swelling and throbbing of the veins. The more serious sorts of symptoms occur when the varicose veins become inflamed, and when that happens, you can get a very painful condition called phlebitis. Patients notice this because the varicose vein suddenly becomes very hard and lumpy and quite sore. Treatment for varicose veins has been revolutionised in the last 15 years. At the turn of the century, we started experimenting with doing varicose veins in what we call a minimally invasive way. There have been several methods developed for treating varicose veins in this way, but the commonest one, and the one which is most widely accepted, is the use of the endovenous laser. This involves inserting a very fine glass rod, a laser fibre, into the vein, usually around the knee, and we then pass the fibre up the leg to the top of the groin, inside the vein. By injecting anaesthetic around the vein, we can then use the laser to seal the vein in the thigh without the need to cut the patient, without the need to put the patient to sleep or keep the patient in hospital. Most patients get better from it within about 10 days, and by about 2 weeks, most people are back to light sports. I'm commonly asked how long it takes to get better from varicose vein surgery and how long it takes before one can do simple activities like driving a car and, most importantly, for a lot of people, flying. As a general rule, I recommend people don't drive a car for about 5 days after surgery. People also often ask me about flight. I prefer it if patients don't fly for 4 weeks after surgery. This refers only to long-haul flight, which is defined as more than 4 hours.